Hello, True Health Seekers, and welcome to another exciting episode of the Learn True Health podcast. In looking at all the topics that we could explore on how you can improve your health, this topic of allergies keeps coming up. Seasonal allergies, food allergies. There's, these external pollutants that are causing issues, or people just have reactions. They don't know what's going on. You can have anaphylactic shock and need to go to the hospital, or you could simply have a sniffle every time you are around a perfume or a food. And then anywhere in between. So many people have, a sore throat or stuffy nose, or they're itching, they're coughing, digestive upset. There's so many symptoms that a lot of times we're told just to take an over-the-counter medication to suppress those symptoms without looking at what is going on underneath, what's really happening that's causing all these symptoms. So like we've learned from naturopaths in past episodes, the body speaks to us in symptoms. It's a language of the body. And if we want to master our health and achieve optimal health and learn how to achieve true health, we need to learn the language of the body, which is the symptoms. So how do we do that if we are so habituated? For many years, I was habituated to all the foods I was eating, so I was feeling really kind of gross all the time, and I didn't have a lot of energy, and I kind of had headaches on a regular basis. But because it was my norm, sort of like a fish in a water bowl, how do you know that what you're experiencing right now isn't optimal? How do you know if you're so used to it, you think it's just the way life is? I've actually met some women who have arthritis pain and they've completely accepted it, like this is just life, or PMS, or cramps. This is just life. This is what's supposed to happen. And so there's so many symptoms that we might completely pass off as this is just the body. Like, hey, this is just my body. I'm supposed to be constipated, or I'm supposed to have diarrhea, or whatever, because we're so used to it. What if all these little expressions of our body, we didn't have to experience it? What if we could eliminate the foods and the things we're reacting to so that we truly are free from all these symptoms, and we get to take our experience of life to an entirely new level where we don't have these symptoms? This is what I'm talking about. Because when I shifted my diet and got rid of the things that I was allergic to, I all of a sudden had way more energy. I stopped getting headaches. I jumped out of bed in the morning. I could not believe it. I thought the rest of my life was going to be that old way where I had to have 5 cups of coffee even to feel alive. And now I don't need the stimulus. So just to give you an example, thinking about all the different topics I could bring you, this idea of the elimination diet keeps coming up. All these naturopaths I speak to and interview keep talking about the elimination diet as a means for figuring out what's causing your allergic responses, what's causing all these symptoms. And through doing the elimination diet, you can remove those allergens that end up allowing your body to lower the histamine response, lower the inflammatory response, which has been known to decrease pain, increase healthy digestion, absorption of nutrition, increase energy. And later down the road, when the gut is healed, people have and I personally know people who have cured their own seasonal allergies. They no longer have seasonal allergies because they healed what was going on in the gut. So today, I have a clip from Dr. Heidi Semanie. We had her in the studio, and I asked her to teach everything we need to know so that we could, at the end of her talk, do the elimination diet ourselves. And we also came up with a PDF that is in the show notes, so you can download the PDF. It's the food mood journal that you'll need to do along with the diet, which will allow you to do it correctly. And so here is Dr. Heidi Semanie sharing with you everything you need to know to be able to do the elimination diet. And she also talks about why do you want to do it and what it'll do for you. This might not be something you're going to start tomorrow, but if you're really eager, you will. It's something that you can learn now, and when you're ready to down the road, implement it. It definitely takes a commitment, but it's worth it, because at the end, you will have a clear roadmap of the foods that are harming you that you didn't even know were harming you, and the foods that you may thought were bad for you turns out aren't. And the symptoms of the body, the language of the body will be your guide to tell you what is and isn't good for you. Enjoy the show. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 43.
Hi, this is Dr. Heidi Semanie, and I'm here with Learn True Health to talk about the elimination diet.
Why do an elimination diet?
An elimination diet is an important thing to try at least once in your life because there's always something in your diet that isn't the best for you. And what I mean by that is an elimination diet will give you more information about your body and the right foods for you than anything else we can offer you. It is a step-by-step approach to finding out what your body does when it's exposed to different foods. Everybody has a different food group that their body will react to less positively. It might not be something scary like anaphylaxis. We're not talking about not being able to breathe, but it might be something you don't even notice until it's gone. And so the elimination diet offers us an opportunity to see how your body functions at a very clean level so that you can make informed decisions about the foods you choose to include in your diet down the line. So there are many different ways to approach an elimination diet. There are a lot of different styles that work for different people, and every practitioner will probably give you some different guidance. My favorite way to do an elimination diet is actually one of the more strict ways. So I'm not everybody's favorite person when it comes to elimination. But I feel like it's best to get a very clean slate before we start. So with a typical elimination, if you were one of my patients, we would sit down and decide on your 3 foods. Typically those foods are brown rice, lamb, and pear. And these are the only 3 foods you'll be eating for 4 weeks. Now this is the strictest. If I can get you to adhere to it, this is how we're gonna do it. And so for 4 weeks, you'll eat only those 3 foods, whenever you want, whatever you're hungry for, whichever of the 3, any combination. At the end of those 4 weeks, we'll have a list of foods that you really want to get back into your life. And so we'll start challenging. And what the challenge looks like is we take one food. So let's say tomatoes are your absolute favorite. So we want to find out if you are allergic to tomatoes. So we'll have you start on a Monday and eat all of the tomatoes you can in every form you can think of. So you can have tomato juice, you can have tomato paste, tomato sauce, fresh tomatoes, some bruschetta, whatever you like, tons of tomatoes all day. And then at the end of Monday, midnight, you stop. No more tomatoes. And you go back to that boring 3 foods for the next 3 days. And what we're gonna do is we're gonna keep a journal and we're gonna pay attention to any changes that you experience during the next 3 days. That might be headache, stuffy nose, GI upset, so you might have some rumbly tummy, some changes in your stool, maybe something as simple as more frequent urination. So we're gonna take a look at all of those things and say you have none of those things. Nothing changed, your energy stayed good, you're feeling wonderful. Well then, on the 3rd day, we say tomatoes are now a part of your diet. So after you've challenged tomatoes, you can keep tomatoes so long as we had no negative side effects. And so on that 3rd day, so maybe on Thursday, we're gonna start and we're gonna challenge your next food on the list. And so say that food is onions. All right, so we'll challenge onions. You'll eat as many as you can and as many preparations as possible. Now these are foods that everybody's like, well, you know, not too concerned with, right? But what if I told you we were gonna challenge dairy, right? So now we're gonna challenge dairy more specifically. Instead of saying you get to eat all the dairy you want all Monday, we're gonna change it up and we're gonna say you can have all the cheese you want. We're gonna go specifically after categories in dairy. So one day would be cheese, another challenge day might be butter, another challenge day might be yogurt, because they're all different preparations of dairy. And of course, plain milk if that's something you're interested in trying again. At the end of the challenge weeks, so challenge weeks often take between 2 to 6 weeks, depending on how many foods we want to challenge and how many symptoms you have. Now let's say we go back to that tomato example, and on day 1 you eat all the tomatoes you can, and the very next day you feel unwell. You have a headache, you have low energy, trouble getting out of bed, trouble concentrating, your bowel movements have changed, you're a mess. Well, we're probably not going to jump right into our next challenge right away. We might take a few extra days of going back to that very basic elimination diet, to allow your body the time it needs to reset so that we can get an honest opinion from your body about the next food we challenge.
Choosing between like organic, like would they be eating, so this brown rice, this lamb, and this pear, what kind of quality, does it matter?
Okay. With the elimination diet, quality does matter. If we're on a budget, we can, of course, make sacrifices. And the sacrifice that we would make on the budget would be to say that your pears don't have to be organic. But you're going to choose a meat product that is as good as possible. So if it is within your budget to have organic, free-range, grass-fed, non-hormone, non-antibiotic meat, that's what we're going to choose for you, because that is the cleanest and it gives us the best idea of what your body's reacting to, because oftentimes we react to the other things, like what the animal has been fed. So if your lamb has been fed corn and you respond to corn, then you might respond artificially to the lamb because that's what it was fed. So that's why we do try to choose the purest version of the form, if possible. But if not, we can make adjustments based on budget. But given free reign, we do want to choose organic, pesticide-free, antibiotic-free.
What if someone's allergic to brown rice or reacting to brown rice, lamb, or pear within the first 4 weeks? Do you look for within the first 4 weeks symptoms?
So for some people, when you start the elimination diet and you may have not exposed yourself to these foods, brown rice, lamb, and pear may not be a normal part of your diet, you may experience some changes. Now, what we're looking for with an elimination diet are the changes that occur in your body. So we would keep in close contact in that first week or two to make sure that the changes that are happening are more along the lines of a detoxification pathway, your body clearing out old junk rather than a response to what you're currently putting in. And we can, with some interview questions and some other things, figure out usually the difference between the two. If you truly are somebody who does not respond well to lamb, pear, or brown rice, we can make substitutions. And often what we're going to do is we're going to look at a list of more what we call hypoallergenic foods. Foods that are known to have less stimulation in the body and to cause less reaction amongst greater populations. For some people, it may be as simple as switching to white rice. For others, we may have to change the starch or the protein completely. So in that case, again, we focus on the quality of the food rather than the specific food. So if you are somebody who just cannot eat lamb, maybe you have an ethical aversion to it, then we would have you go for the leanest, highest quality turkey that we could, because turkey is less inflammatory or less response producing in most people than things like chicken or beef.
What about vegetarians? How do they do the elimination diet?
For a vegetarian to do the elimination diet is pretty simple. We often just eliminate the portion of the diet that includes the meat and find a plant-based substitute so that the person still can have protein in their diet. This can be a little tricky because a lot of the plant substitutes for protein are hard for the body to digest. So there are oftentimes some reactions that you see because the body's not quite accustomed to what we're doing. But when we're talking about somebody who's been a vegetarian for a while, the transition's usually pretty seamless, and we often just use whatever their primary protein is, whether it is a bean or a pea-based. And often we choose to use it in a supplement form because that way we know it is as clean as possible.
On challenge day, so talk a bit more about challenge day. When you say eat tomatoes, is it that because you said bruschetta, people are thinking it's on bread. You're only doing the tomato without other ingredients. So I wouldn't go eat a marinara sauce because that would have onion in it. Could you elaborate on challenge day?
Yes. So challenge day will look different for different people, and it also depends, like I said, on how strict we're being with this elimination. Some people will choose to do a less stringent program and introduce more than one food at a time. This is not the best way to do it, but it does happen that way. So oftentimes when I gave examples of different foods containing tomato, I was more trying to encourage you to think about the ways that the food is prepared and less about the other things we added to it. So in the case of tomatoes, yes, we would go more for boiled, baked, steamed, and other preparations instead of thinking about things that are additives like a marinara sauce or, like I said, bruschetta, because of course that also has cheese and bread, and that's not what we're looking to add on an elimination day or on a challenge day. Other things that come up during an elimination challenge, people want to know if they should maintain their medications and supplements. Anything that is prescribed currently by your physician that is pharmaceutical grade is something that we would not remove during a challenge. We may, however, remove some of your natural supplements because as natural supplements, they're most likely adding to your health and not helping to control a condition.
You can do the elimination diet for supplements.
Some people experience reactions when they start taking supplements. So maybe you've been somebody who's had a very clean diet your whole life and you're looking to make a change in one aspect of your health. And so you're recommended a supplement. And you find that you're having some kind of response to the supplement that isn't the intended effect. In that case, we can also pare down the supplements. We can look at the different additives in the supplement itself, or we can just challenge the supplement to see if it's truly what you are reacting to.
What are the commonly asked questions around the elimination diet?
When most people are given the task of taking on an elimination diet, they often ask if they can have a food that hasn't been listed. And that's why I like to keep it simple and only pick 3 foods. Then you don't have a concern about whether or not you can also have your coffee or your chocolate or any other food, because like I said, other practitioners may do it differently and have you pare down by food group or by food type instead of making it very, very simple. So the biggest question tends to be around what can I add and when can I add it? And so what might happen is after a couple weeks, if we have a good response and all of your bowel movements are on track and you're resting well and you're getting everything else that you need in life, we may begin challenging early. But truly, when we're doing an elimination challenge, we're asking you to for 4 to 6 weeks of your life to find out what exactly is going on. An elimination diet isn't something that just walking off the street and we say, oh, you do an elimination diet, you do an elimination diet. They're used specifically as a tool to find out what it is in your food source or in your supplement source that is causing you an aggravation or not allowing you to absorb your nutrients in the way that is optimal.
Would you say that that when they eat a food they're reacting to, that their reaction is, what they're experiencing is inflammation?
Okay.
Is it always inflammation?
That's tricky. So what is a reaction? So say you challenge a food and we talk about your symptoms and we've decided that you are reactive to that food. What does that mean? What's happening in your body with a reaction? Typically what we're talking about is an antibody-mediated response, so something that is causing inflammation. Inflammation in the body is just a fancy way of saying swelling. So if a person is responding to a particular food, that response is usually triggering inflammation in the body. And inflammation in the body is another way to say that the tissues are swelling or drawing water in. And when that happens, they're unable to function optimally. So generally, the response that we're calling a reaction in the body is just that of increasing inflammation in the body.
So let's say I was your patient and I'm about to walk out the door and do an elimination diet.
Mm-hmm.
Do you feel confident that I know everything I need to know?
Other tools that we'll give you when you begin the elimination diet are a food journal that includes things like mood and constipation, gas, belching, as well as frequency of urination and bowel movements. And the reason we ask you to record all of these is because some things change in the body that are so subtle that you don't recognize it as a reaction. So we would ask you to also keep very close track of what's happening in your life for this 4 to 6 week period, especially during the challenge phase, so that we can recognize what hurdles you face on your journey.
Would they do a food mood journal before they start the elimination diet, so they have like a this is how I was before, and then compare it to the 4 to 6 weeks, or?
Most people who are being encouraged to start an elimination diet have usually had some sort of experience with GI upset and have probably tracked their foods in some way or another throughout their time in trying to figure out what's going on with them. But in this case, we're not looking so much for a comparison before and after, because if you truly have a food sensitivity, that comparison is going to be very obvious. What we're looking for is a difference in the day-to-day while you're in the program. Specifically, like I mentioned, it's important after we've done a food introduction. So what's the difference between the baseline, which is those 4 weeks when you're just eating the very simple diet, and the changes that occur over the few days after the introduction of a food? So that's really our most important. So while I would very much like for you to be charting every day, because that gives me more information as your physician, gives me more tools on how to help you, charting on keeping track of your food intake, your mood, and everything else is most important during challenge weeks.
Cool. So it could take like a year.
For some people, the elimination diet is a very drawn-out process. It doesn't happen often, but it does happen that people have a system that is so overwhelmed by other things in their life as well, because the elimination diet is only focusing on one very small portion of your wellness. Emotional status, life, everything that comes up, access to foods, access to the clean foods is sometimes limited. We travel, we have work obligations. Some days we just can't get away from a particular food. So for some people, there are slip-ups and mishaps, and we have to go back and retry and get the diet clean again because we're not sure what the reaction happened. So in most cases, within 6 weeks, we have a diet that has enough variation in it to keep the patient happy and to still allow us to further investigation time. But for most people, an elimination diet will be completed within a couple of months and they will have the answers they need. But very rarely it can extend longer if we have a more complicated case.
Awesome. Are there foods that you would recommend people all the time avoid?
So people sometimes ask, if they're not going to do an elimination diet, are there particular foods that they should avoid anyway? And my answer is yes, of course there are. Most of us do not have the enzymes necessary to process dairy very well. So for most people, I recommend removing dairy, especially if we are dealing with a GI problem. And I know you're not going to like hearing it, but gluten. Unfortunately, in our day, most of our foods are saturated with byproducts or are produced in a factory that also produces gluten. So there's a lot of cross-contamination, and it's difficult to glean out which grain you may or may not be responding to. So we ask that during an elimination diet or during just daily life, if you're looking to improve your digestion, you would remove gluten to see what would happen. Other foods that are commonly problematic for people include soy and corn. And those are kind of my big four. Of course, there's always the inclusion of fried food. As we know, frying food, although it makes it taste delicious, really does add a lot of negative qualities to the food and takes away from its nutritional value. So avoiding fried foods is kind of a must if you're looking to optimize your gut health. Other foods that are highly reactive for a great population are corn and soy. And although I always recommend avoiding fried food, I would also recommend avoiding packaged food. It sounds inconvenient to spend the time during your week preparing your own food, but when you know what goes into it and you make it with your own hands, we have to worry less about what other things might be lurking in your food, so we have less problems when it comes to something like an elimination diet. So prepackaged food, you can almost always counting on having extra sugar, extra salt, extra sodium, and other preservatives that are going to interfere with your body's ability to absorb it. So I guess the list includes dairy, gluten, corn, soy, fried food, and prepackaged food.
Thank you so much, Dr. Heidi Semanie, for teaching us how to do the elimination diet. For all our listeners, if you would like to participate in the elimination diet and you want the downloadable PDF that is the Food and Mood Journal, please go to the show notes of this podcast episode and you can find them there at learntruehealth.com. That's learntruehealth.com. Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. Takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.